Good afternoon, I'm Ryan Baker. Governor J.B. Pritzker is holding his coronavirus news conference from his home, and that's because the governor is self-isolating after another one of his staffers tested positive for COVID-19. Let's listen in.
At this point, I and every member of my team who comes into the governor's office tested negative in an office-wide check Monday afternoon. I spoke with the staffer who tested positive, and they have some symptoms but are in good condition and resting at home. Let me take this opportunity to remind everyone that there is testing available to literally every person in Illinois, whether you've potentially been in contact with a COVID-19 case, if you're feeling unwell, if you just want to check in, you're able to get a test at no cost. You don't need insurance, you don't need to be a citizen, you don't need symptoms, and in most places, you don't need an appointment. You can find the state-run testing site closest to you, as well as a list of the hundreds of private and commercial testing sites across the state at dph.illinois.gov/testing. Again, dph.illinois.gov/testing. On to our COVID-19 update for the state. Over the last 2 weeks, 9 of our 11 regions have seen their average positivity rates decline, even as our state is performing tests at record numbers. That is really good news. Not every region is succeeding to the extent that we need. Unfortunately, yesterday, my administration announced that because it has surpassed 8% positivity for 3 days in a row, starting this Saturday, Region 1, home to Rockford and Dixon and Galena, will need to adhere to the COVID-19 resurgence mitigations. Those are the same ones that are currently applied to Region 4. IDPH has been in conversation with county health departments to discuss preventative measures that they can take at the local level. Region 1's concerning uptick in positivity, jumping more than 2 percentage points in 2 weeks, demands increased focus on stopping the spread. In the past week, Region 1 also has had an early indication of increasing hospital admissions for COVID-like illness. Although this increase has not yet reached the threshold level, it does indicate an increasing seriousness of the illness caused by the virus, so we're watching that closely too. Like the other regions that have exceeded 8% positivity, Tier 1 mitigations will be temporarily imposed, including all bars, restaurants, gaming facilities, and casinos will close at 11 p.m. All indoor bar service and indoor dining will be closed. Outdoor bars and dining may offer table service if they follow tightened mitigations, including that all patrons must remain seated and that reservations will be required for every party. Party bus services must temporarily close, and gathering limits will shrink to the lesser of 25 individuals or 25% of overall capacity in other locations. In the coming days and weeks, depending on whether we can slow the infection rate in Region 1, these mitigation measures could be removed. They could be maintained or even strengthened. To a large extent, the path forward will be up to the residents of Region 1. I encourage everyone to wear your masks, encourage others to wear their masks, watch your distance and wash your hands. And if we all put our public health first, there will be fewer infections, and that means fewer restrictions and quicker return to normalcy. As has been the case, the average positivity rate over a 14-day period starting this Saturday will be the indicator. If the region gets itself below 6.5% for 3 days in a row, the new mitigations will be lifted and the whole area will return to the current Phase 4 mitigations under the Restore Illinois plan. These rules are not meant to be a punishment, and I don't particularly enjoy having to deploy them. But we have got to keep people healthy and safe. The vast majority of our Restore Illinois regions, that's 9 of 11, so far have not required additional mitigation. Sorry, 8 of 11 have not required additional mitigations since all of the state reached the current phase of our reopening plan in late June. That's nearly 3 months to the day. We all want to have our schools and our businesses open, and we can do that by keeping community spread low and infections down. Illinoisans are proving that we can do that, and they're proving it every single day. So thank you, and with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you so much, Governor. I will start with the case and test updates. Today, we are reporting 2,273 new cases of COVID-19 and unfortunately 35 deaths. In Illinois, we have now seen a total of 293,274 cases and 8,672 lives lost. 1,632 individuals across Illinois were reported to be in the hospital overnight with COVID-19. Of those, 378 were in the ICU and 152 were on ventilators. In the last 24 hours, more than 58,000 lab tests were reported for a total of more than 5.6 million tests. We are seeing some good trends, like in Region 7, which was able to move to phase 4 of Restore Illinois after implementing additional mitigation. But as the governor mentioned, we've also seen some troubling trends. In Region 6, which includes the University of Illinois at Urbana-Champaign, IDPH has been carefully examining the data. This is a really unique situation where repeated saliva testing for staff and students at the Urbana-Champaign campus results in a tremendous number of tests, up to 20% of all the tests done in the entire state. So while that region with those saliva tests is seeing a test positivity rate in the 2s, without Champaign County and those Urbana-Champaign tests, that rate skyrockets to over 7%. We want to ensure that the large volume of tests at Urbana-Champaign does not overshadow the trends that we're seeing in the broader region. And we don't want to be inhibited from taking action to keep people safe. Therefore, in addition to providing data for Region 6, IDPH is now presenting data for Region 6 without Champaign County's numbers. If regional metrics are tripped in Region 6 by looking at the data in this way, the entire region, including Champaign County, will still be required to implement mitigation efforts. IDPH is in contact with local health departments and community leaders in the region and is encouraging them to begin taking action right now to reduce the test positivity rate. As we enter fall and winter holiday seasons, IDPH is committed to ensuring our communities have the best public health guidance to stay safe. Today, IDPH released guidance for Halloween, which can be found on the IDPH website on the COVID-19 page under guidance. For Halloween, we are encouraging people to find ways to celebrate that might look a little different than in years past, but we still allow our children to take part in these festivities. Trick-or-treating could now involve just setting out individually wrapped pieces of candy spaced out on a table where kids in costumes socially distanced can still pass by and retrieve it. Activities like hay rides, pumpkin patches, orchard visits are allowed with limited capacity, masking, and social distancing. For anyone wearing a costume, whether a child or an adult, a costume mask is not a substitute for face covering. If face coverings are worn under the costume mask, please ensure that this does not create any breathing problems. And if it does, don't discard your face covering, put the costume mask aside. Haunted houses are not permitted under phase 4 of Restore Illinois. We are also asking adults to avoid crowded costume parties at home or at bars, which can absolutely increase your risk of getting COVID-19 and spreading it in the community. These are unprecedented times, difficult times, but I encourage people to accept the situation, but try to be creative this holiday season. Challenge yourself and your kids on how you can celebrate these holidays as safely as possible. Keep washing your hands, keep watching your distance, and keep wearing your mask. And of course, get your flu shot before the end of this new month coming October. The sooner the better.